Dr. Nilesh Soni is a well-known expert in the field of physical therapy and vast clinical experience spanning over 30 years. His credentials include a doctorate from Harvard affiliate MGH Institute as well as multiple masters in biomechanics. Dr. Soni and his team of expert physical therapists have helped more than 20,000 New Yorkers restore their physical functions at dynamic physical therapy. Dynamic physical therapy is one of the very few Indian-owned health services listed on the prestigious Inc. 5000 list of fastest growing companies in the United States. और हैरम टीवी में अब सौभाग्य से हमारे साथ दर्द को दूर करने में विशेष रूप से कई दशकों से सक्रिय रहे डायनेमिक फिजिकल थेरेपी के प्रेसिडेंट और सीईओ डॉक्टर नीलेश सोनी जी जुड़ रहे हैं. नीलेश जी, स्वागत है आपका.
नमस्कार अशोक जी.
So as we move towards a better world each and every day consciously, doing away with pain becomes very, very important.
We were discussing about an exciting new technology which is called Musculoskeletal Ultrasound, and that technology uses sonic waves and ultrasound waves basically to identify issues with your joints and muscles. And shoulder joint can be evaluated effectively using this technology.
So we'll come back to technology a little bit more, but थोड़ा कंधे की बात करते हैं. और जो फादर्स डे आ रहा है उसको लेते हुए भी कंधे की तरफ जाएं तो माता पिता, विशेष करके पिताजी ना, अपने बच्चों को कंधे पे बिठा के बहुत घुमाया करते थे. हालांकि आजकल वो स्थितियां नहीं रही हैं, पर कभी कभी ऐसा होता है कि कोई वजन उठाया हो, उसका दर्द कई साल के बाद में भी आ जाता है. Does that happen? Have you seen that?
Yeah, so shoulder pain is a very common pain because most of our activity, what we do in our daily living, is called forward-reaching activity. Means we use our hands to reach out for objects, or to manipulate your keyboard, or lift things in the kitchen, or push and pull doors. So every activity we do are forward-reaching activity, and shoulder joint plays a major role in stabilizing and powering those activities. So with wear and tear, or with overuse, or with a wrong use, you can get shoulder issues, and we need to find out what exactly happens to the shoulder muscles or shoulder soft tissues or the joint itself. And as I was mentioning, musculoskeletal ultrasound can help us identify the scope and severity of the issues happening to your shoulder joint.
So you are moving, and yet that musculoskeletal ultrasound is able to detect where the pain is.
That is correct. So the beauty of this technology is this. First, it can be administered on outpatient basis. It is painless. It can be done within 15 minutes, so a very short time. You don't have to do any invasive procedures. And again, you can move that part where it hurts. So basically, suppose it's hurting in the shoulder joint. What if I can open the joint, look inside what's wrong, and try to fix it? So that kind of sort of information we can get using this test. So it's like we know exactly where to look in, and we can get that look of your painful structure in the shoulder, and then devise a treatment for it.
And another beauty of this is you instantly get the result.
Yes. In fact, you can move your joint, and our clinicians can explain, hey, this painful area, so this is what's happening, this is getting impinged, or this is where the fluid is collected, or this is where the tissue is torn, or this is where the muscle is injured. So we can pinpoint the injury on the screen while we are doing the test and explain you why you're having that particular dysfunction.
So this sounds like a very important way to detect where the pain is. And post COVID-19, it is difficult to get a lot of tests done. In this case, it is simple. And talk to us a little bit about the concern that people have, whether it is covered by insurance or not.
So it is a very quick test, and the U.S. Army uses this test to identify issues with their soldiers in the field, to make a quick judgment whether the soldiers can continue with aggressive physical activity or they should stop. And yes, it is done very easily. You don't have to wait for cumbersome appointments and authorization for a CAT scan or an MRI. If you have soft tissue issues around the joints or the muscles, this test helps. And as far as insurances are concerned, there is no out-of-pocket cost. Most of the insurances cover it because it's the new and very reasonably reimbursed technology. The cost of doing such tests is similar to getting an X-ray. So even if in the worst case scenario, think about, say, no insurance is covering, then also the out-of-pocket cost is just like you're paying for your X-ray. So it's very little. But I would stress again, most of the insurances cover this particular test. So people having insurances should not be having that as a concern.
So, Nirji, let's talk a little bit about general maintenance of shoulders. As a physical therapist, do you have some recommendations as to what are the basic precautions that one should take in order to stay healthy shoulder-wise?
So first thing, as I said, a lot of activities we do by reaching forward, right? So think of activities where you have to reach backwards with your shoulder. Think of being active with your upper body. So if you are not able to do push-ups on the floor, do wall push-ups, like standing against the wall and pushing with your pressing against the wall. The other thing is you do a little activity, any physical activity, in terms of playing with a frisbee or playing, say, cricket with your son in the ground, or going out and doing any upper extremity activity will help improve the health of your shoulder. Of course, if you have any arthritis or any rotator cuff injury, you would want to consult a clinician and then devise an exercise program. Not going to the gym right now? Well, this is the time. If at all, if you have any physical ailment or you have a history of arthritis, not going to the gym is okay, but you can go to a clinician just like me, like a physical therapist, and get active by knowing what type of exercises, activities you can do for your shoulder.
So knowing what to do and how to do is very, very important. So one, you have recommended that there should be movement, which is very good. But sometimes if the movement is not right and it is not being helpful for your body, rather than helping, it may harm.
Yes,
So,
I absolutely agree with that. Right.
so for shoulder, is there anything like precaution wise you shouldn't lift much, or what are the basic tips?
Right, sure. I would say that slouching in general, like you're rounding your shoulders forward, like you're curling your neck and your upper body, can affect the shoulder mechanics directly. Because of the rounding of the spine, the shoulders also sort of round forward, or in our language, what we call protraction of the shoulder. If that happens, the structures in the front of your shoulders get tight, and they lead to a lot of compression in the joint and impingement in the joint. So try to get away from the slouch, do activities which are just opposite of the slouch periodically, like you just straighten up. So they say, like we all do that. We love slouching, but slouching, people are concerned about the spine, but along with the spine, your shoulders also round forward. So in order to avoid that, you slouch, you decrease your slouch, you will see that your shoulders are retracted, and you get a little more opening in the front of your shoulders.
Wonderful. So have strong shoulders, and so that if they are needed for someone to seek your help, you have strong shoulders right there. Now the question is, there are some simple exercises. Sometimes they are enough to help you come out of the pain that you are feeling. So
Absolutely.
you must be determining when you need to use musculoskeletal ultrasound, and
Right.
talk to us a little bit about anyone who you felt was greatly helped in terms of the pace of recovery.
Suppose if you have subacromial bursitis, it's a condition where the gel-like structures in your shoulder, it's inflamed and it becomes bigger than its size. If I go and ram your shoulders while you have such condition, means I exercise overly, then it may increase your pain. So musculoskeletal ultrasound helps us determine that if such condition is occurring, to avoid certain kinds of aggressive exercises for you. So it's very important to do activity. But then when you have a condition, it's very important to know what not to do to aggravate, prevent aggravation. And musculoskeletal ultrasound is a great tool to determine that scope and severity of your issues. And that helps us to sort of narrow down and help us do correct exercises. I had a patient with a heel pain, and the gentleman was a businessman working in the Diamond District, and he could barely walk. And we, through the use of musculoskeletal ultrasound, we determined that he had some, swelling in the muscle of the calf muscle, and we did 3 sessions of treatment, which were appropriate after that musculoskeletal ultrasound. And luckily, he could walk again. And that resulted into referrals of 8 of his family members. And now, instead of 1 patient, we have 8 patients in a matter of a week. And that I would say that that attribute I would give to our use of such technology, which is called the musculoskeletal ultrasound. It's like an added tool for us to make our treatment more efficacious.
You have shared that it is pretty simple, yet you need some expert technicians or those who are handling it. From that
Right.
point of view, talk to us about dynamic physical therapy office, and also I believe sportsmen probably are also greatly helped by this.
This is a technology which is used very widely in the sports industry. Think of a football player playing and getting hurt or having pain while active on the field. This particular technology is used to determine if the quadriceps muscle is torn or it's just stretched or it's just pulled a little. And right there and there on the field, this test is conducted to find out if the player will continue playing or they have to decide to hold that player off the field, right? So yes, it's very easy to use. It is painless and it is precise in identifying your issues.
Wonderful. So as we move towards the concluding part of our conversation today, Nilesh, you are a father yourself, and Father's Day also now demands fathers to be a little bit more creative so that they can build that bridge which brings about a sense of celebration. So as a physical therapist also and as a father, what tips you can share?
So first of all, happy Father's Day in advance to you, Ashokji, as well as all the viewers.
Thank you.
And yeah, building bridges with your son, right? So I would recommend you to visit New York City area bridges where they allow walking, and there are
Wonderful.
plenty of them. There are plenty of them in our neighborhood. You can walk underneath the Throngs Neck Bridge. This is an example. But yes, building bridges with your kids through physical activity. May it be walking, biking, throwing a frisbee, playing tennis, or playing table tennis, but doing a physical activity which involves your kids with you will help you not only understand them better, but it will give you a sense of achievement for yourself too, because you're doing physical activity and keeping yourself fit to run after them as needed.
Wonderful. So run for fun and run together sometimes with your son. That is a wonderful tip, as well as I think it's a novel idea that fathers should plan to explore New York City and especially bridges. So
I did it. I mean, I did all the walkable bridges of the city with my son over last 3 summers.
wonderful. So happy Father's Day to you, and thank you very much for being a part of Harem TV. And as I conclude, let me also recollect that Harem name comes from Lord Ganapati, and we also know that his respect for his father and mother is a part of our memory bank. So, wishing auspicious happenings for each and everyone. Thank you very much, Neeraj, for joining.
Namaste, Ashok.
Welcome to Dynamic Physical Therapy, where we strive to get results, not just a Band-Aid. Our therapists are experts in identifying the root cause of your pain and eliminating them for good. Dynamic physical therapists are all highly trained in manual therapy and are musculoskeletal experts. They understand how your body works and are highly successful in locating dysfunctions. They use proven scientific methods to get long-lasting pain results.